So when we're checking a patient's blood pressure, we want to make sure that the patient has relaxed for a few minutes, approximately 5 minutes, and they should be seated in a comfortable position. You want your back to be relaxed against the chair and your feet uncrossed and on the floor. You want your arm to be supported, so I would sit it up on the desk there, and then we want to have a blood pressure cuff that we know is the correct size. So you can go ahead and grab the blood pressure cuff. A blood pressure cuff that is too large can falsely make the blood pressure too low, and a blood pressure cuff that is too small can actually falsely elevate the blood pressure. You want to make sure that you put the cuff directly against the skin because that's going to be a more accurate blood pressure reading as well. The patient continues to relax and should not be speaking. The blood pressure consists of two numbers. There's the top number, which is the systolic. The bottom number is the diastolic. The systolic means, or systole means when the heart is squeezing, and the bottom number is the diastolic or diastole when the heart is filling. Some people think one number is more important than the other, but it is very important that both numbers be controlled. So normal blood pressure is less than 120/80. That is actually much lower than most people think. But we really don't start blood pressure medication in most populations until 140/90. But by stressing the importance of less than 120/80, we can intervene with lifestyle changes first. So decreasing the salt in your diet and exercising on a regular basis if you're not doing those things already. So it's important to screen for hypertension to help prevent end organ damage from high blood pressure. And that would include things like heart attack, stroke, congestive heart failure, and kidney failure. One thing that's important to know is that high blood pressure very often does not cause any symptoms, and that's another reason why it's important to get screened even if you have no symptoms at all. So everyone should check their blood pressure annually, but if you have been diagnosed with hypertension and have been placed on medication, you do not want to stop your medication unless you've been advised by your physician, and you should really come back for your visits every few months as advised by your physician. If you come to the doctor, your blood pressure is a little bit on the high side and you don't think that's normal for you, it is a good idea to get a home blood pressure monitoring kit, check your blood pressure at home, and bring those numbers into the office so we can review. Some people actually have white coat hypertension where their blood pressure is high at the office but will be normal at home.